And here's one of the things that I think about traditional health insurance, not Medicare and Medicaid. We understand those are federal government insurances, and there's a lot of other federal government insurances, whether it be VA or what have you. But the Premier Blue Cross or United Healthcare, whatever. As far as I'm concerned, they are not private insurances anymore. People say, "Well, I have
No,
good private insurance."
no,
You know
it's
what?
not private insurance.
It's not private because the government is so heavily regulated that they tell them what to pay for at what cost.
That's why when I say Medicare, Medicaid, and government mandated insurance, I want to make it clear. First of all, as I said before, starting off, comprehensive health insurance was never anything the market wanted. This was just a way to get around, in the same way, similarly, that now health sharing and other things that are coming up are ways to get around existing regulatory burdens or proposed regulatory burdens. That's it. No one was saying, hey, let's find a way to add unnecessary bureaucracy to healthcare and make it way more expensive and tougher to get and make there be a line for healthcare. Let's do that. No one was saying that. They did that to get around a regulation. But you could choose who you wanted for your health insurance. You could choose whether or not you wanted health insurance. So there was at least some aspect of market principles to it. Now, that's not the case. Now you have to get it. Now in some states you get fined if you don't have it. And for a while you were fined at the regular level you were taxed at the regular level. Any of us would call that a fine typically. It is a government mandated thing, and then just as importantly, it is a heavily, heavily regulated thing. They decide, as we were talking about with pharmaceuticals, if the health insurance company wanted to say, okay, great, you found a new way to deliver insulin, but this other way was working fine and it's been around forever and it's a generic, we're going to just cover that. The federal government, who is owned by those cronies that introduced that new innovative way of providing insulin, says, no, you have to only cover this type of insulin. And they go, okay, fine, we'll cover it. We're not paying for it anyway. You are the taxpayer. And so they now are covering that. And that's why the costs go up. And so the side effect of that is when someone is poor and doesn't have coverage and can't afford it, they die, or they rely on GoFundMe's to pay for their insulin. And then other people will say, look at this. This is the free market providing healthcare. This is the problem, is that the free market has driven up the cost of insulin and made it where people have to go on GoFundMe to get insulin. We need government-run healthcare. That's what we need. We need at least single payer, where the government's paying for all the healthcare, or preferably where the government is managing healthcare entirely. I have met enough people who are using single payer healthcare in other countries, and I've met enough people who are using the VA and the National Health Service in the UK and the VA here to tell you that the more government is involved, the worse it will get.
Absolutely.
And that harm is going to disproportionately affect the poor